Afia Asamoah recently joined the board of Rise Up Together, a global nonprofit working to advance gender equity in health, education, and economic opportunity by partnering with local leaders and organizations around the world. This is just the most recent avenue Afia has taken to improve health. She is also board director at Stanford Children's Health, the Public Health Institute, and the Carol Emmett Foundation. Her day job is co-founder, general counsel, and head of people for Waymark, but she has also served as head of legal for Google Health, worked as senior associate in a major legal firm, and clerked in the Southern District of New York. I'm so pleased to welcome Afia Asamoah to the Treasure Hunt. Afia, your undergraduate study was in psychology and pre-med. What got you interested in health and healthcare?
Well, it is a pleasure to have this conversation with you, Doug. Thank you so much for having me on the Treasure Hunt. To answer your question, I'll begin with my dad as a doctor. My maternal grandfather was a pharmacist. I grew up in a family that just had a service ethos, right? Like, we were expected to figure out ways in which we could kind of give back and serve others and make the communities in which we operated better. And given my exposure to my dad and my grandfather, I assumed I would go into medicine, and had this intent to be a doctor practicing specifically in under-resourced communities. And I felt that was the path. That was the path I should choose, to give back and be of service to folks around me. My perspective shifted a bit, though, in college. So they had the opportunity to go back with about 5 other undergrads, and we were led by a woman who had her public health degree, and we were partnered with a community, a village in Ghana. And the mandate was to partner with the nurse that was staffing the local clinic and the elementary school that was in that community, and kind of think about ways in which we could give back from a public health perspective. And paired with, there was a local regional hospital, and we had opportunity to kind of shadow doctors there and find ways in which we could be helpful. And my observation of myself, having both of those experiences, was that when I was shadowing the amazingly talented doctors doing the work in the surgical ward, I also just was confronted with the constraints of kind of working within that system, especially in an under-resourced setting. And I paired that with the public health work we were able to do in the village in which we were staying, where we partnered with the nurse in the clinic and ran vaccination campaigns and had amazing opportunities kind of partner with the elementary school students and kind of think about ways in which we could do public health messaging and went to additional communities and schools nearby to do that work. And it highlighted to me that there was so much opportunity to think about how you design health systems to make them more equitable, to get upstream of the problem. And I left just thinking that I want to kind of work on questions about how do you build systems that work for everyone? How do we make sure that where you live, how much money you make, does not dictate the type of care you get? And so with that frame, decided that I was 100% committed to healthcare, but maybe being a doctor was not the way in which I would do the service. And so a series of experiences got me very interested in how can technology improve access to care, specifically for underrepresented populations. As you mentioned, I began my career in a law firm. In that law firm, I was in the food and drug practice group and had the opportunity to kind of work with and support medical device and biotech companies. Got very interested in how they think about developing products, because they are the ones that are innovating and providing access to products that improve care. Had the opportunity in a policy role to join the Obama administration as a special assistant to the commissioner at that time. And again, that was just a fantastic opportunity to think about how you pull regulatory levers to spur innovation. And again, my thesis, how do you spur innovation that serves all people, particularly underserved people. And then when I went to Google, got incredibly interested in terms of how you could use technology to just kind of push care outside of the clinic walls and meet people where they are. And with all of that background, 4 years ago, as you noticed, I partnered with two physicians and co-founded a organization that's kind of the culmination of that. Like, how do you use technology to transform care delivery to patients with Medicaid, which is a great proxy for me, at least operating in the U.S. health system, for underserved populations. So I would, I guess, end by saying, like, for me, healthcare touches all people. It's directly tied to economic justice. Like, if you don't have the foundation of healthcare, like, how are you doing the things you need to do to kind of contribute in ways that everyone wants to, right? To their families, to their communities, etc. And I feel deeply that social circumstances should dictate the type of care that you receive. So that's what got me interested in healthcare, and it kind of keeps me committed to the work.
Wow. I love the journey that you just took us on about your own widening perspective, how the horizons in your own thinking expanded, which really led to new ideas in terms of career, vocation, and the kinds of work you do, which is quite varied. I mean, you've continued to expand your understanding of the ways to exercise influence to make things better through all of these changes, haven't you?
I have, and I guess there's power in working in healthcare because it's just purpose-driven and mission-driven work. And so for me, my career has been kind of guided by this: how can I be helpful in terms of moving the ball forward in healthcare? And if I'm doing that, I feel like I am being both impactful, purpose-driven, and I will love the work. And like, there's just clarity. There's clarity in that. And the point around like healthcare touching everything, there's so many ways in which you can impact the healthcare system to, in my framing, make it more accessible for all people and more equitable. And so there's fun in that as well, right? Because your career can show up in all these different environments and different industries, but still kind of moving forward and having the impact on healthcare in a way that I think is really impactful and needed in the world.
That speaks to me. The highest virtue in my catalog of values is usefulness.
Yes.
And I really love what you were saying in terms of how we make the judgments about what paths we'll take. Now, I'm curious about your leadership. Not all lawyers are successful in moving from giving advice to leading others. What have you learned in growing from, and you're still a technical expert, but from technical expert to organizational leader, different roles?
Well, I appreciate the compliment embedded in the question, Doug, so thank you for that. I would say, and I think maybe, I don't know, I've talked to like a lot of women, and I think people go through this transition as well. Like, early in my career, my belief system was the way that I can be impactful is to be a subject matter expert. Like, I should just be excellent. And my sphere of influence, like, I should be an excellent healthcare regulatory lawyer. And I thought that was the way to get influence and have impact. You should be dispensable. You should know your stuff cold. And you should do the little things well. And be someone really that folks can depend on. My learning is like, yes, you need to do all those things, but that's just the foundation, frankly, in terms of being influential and having impact. And so what I've learned is there's a whole slew of other things that are incredibly helpful and important, right? Like, you need to be able to exercise good judgment. I think you need to be curious about others, ask really good questions, be a great listener, and kind of have, like, as your guiding star, being a person of integrity, and like always trying to like make the right decision, which is hard to do because the world is so complex and so ambiguous. But like, with those things as your guiding star, I think like you're more likely to be influential and impactful. So my sense is that like, it's things I just listed that actually gets things done. And influence isn't really being the smartest person in the room. It's like the ability to kind of build relationships, lock arms with folks to kind of collaborate and get things done. And that's just been like, it's incredibly helpful frame for me as I kind of transition from, you know, I'm like a young lawyer that kind of really knows her stuff around healthcare regulatory law, and being an organizational leader where I want my impact to be working in organizations that are having impact in the communities around healthcare issues, particularly around healthcare issues working on underserved and underrepresented populations. I guess the last thing I'll say is that my learning is that it's just a different skill set, frankly, than being a technical expert. Like, you really kind of have to lean into like emotional intelligence and really kind of relational. It's relational, both in terms of, you know, like listening, understanding what motivates folks, how you can connect with folks, and equally important, be self-aware in terms of like how you show up and how you can be most influential in the kind of rooms you're in and the conversations that you're in. I found that curiosity has been my best friend. I think you have to be curious about the business in which you are operating in. I think you have to be curious about what motivates people. I think you have to be curious about problems outside your domain, because you're a problem solver, right? Like, not a technical expert. And the transition isn't necessarily easy, but I think I found that if you can help people do your best work, that's your orientation, that's where the impact happens.
Oh, I appreciate that. I think that's useful. One of the things that you're illustrating very clearly to me is the kind of shift we've seen over the last 30, 40 years in many places in terms of the kind of metaphorical framework about what leadership is.
Yes.
So, you know, the image of leader, I think, you know, that we were raised with, that have influenced us and maybe affected the way we think about technical expertise too, was somebody leading the charge, which means they're out in front, everybody's supposed to follow them. And so leadership and followership were big categories in leader development before. But I'm hearing what you're saying is that leadership is really about gathering the people to go to a place that improves everything for everyone. And that's a very different metaphor, the kind of gathering. And I know these have been associated, and I don't want to push this too hard, but they often get associated with gender differences in terms of these metaphors too. And I think there's something to that. What do you think?
I think there is. I think everyone should lean into their own strengths. And I've come across a lot of, I'm oriented that way. I think I care very much about relationships. I think the world is too complex and problems are too hard to go it out alone. I want to enjoy the work I'm doing. I enjoy it more if people enjoy working with me and I enjoy working with them. I agree with you. I think society, it's a little bit of chicken egg. I think like society has associated a lot of the things I'm discussing with women. I think if you are wired like I am and you happen to be a woman, like you should lean into those skills, because I agree with you 100%. I think in a way that's very positive. I think we're expanding the idea of what leadership looks like in a way that's like more inclusive, allows more perspectives and voices to be around the table. And so I lean into that. I think that's fantastic. I agree with you. I think we should underscore and encourage more folks, men and women, frankly, to kind of lean into these skills, because I just think it's the most way to be impactful, kind of solve really hard problems.
Beautifully put. I know that you're a limited partner in SIA Ventures and Jumpstart Nova, as well as How Women Invest. You've been involved with the last group for about 5 years, as I understand it. Tell us about what inspires you about that work and why it's so important.
So as you mentioned, of all the three you mentioned, I've actually been longest tenured with How Women Invest. And the work has always inspired me because it's about getting investment and resources to people with good ideas. Period. That's what we're trying to do. And the statistics, at least around kind of like funding entrepreneurship, shows that women founders receive less than 2% of venture capital funding. And to me, it's just nonsense if that's the case. Like, it's not only unfair, it's just nonsensical, because we're leaving brilliant ideas, brilliant solutions off the table because people are not showing up in a form that we're used to seeing and expect to see with respect to kind of entrepreneurship and kind of co-founders. So what drew me to the How Women Invest in the work is that it just allows people to be seen. Like, that's been, in addition to like healthcare being my kind of guiding star, healthcare specifically in terms of like just making more equitable care for all people, particularly underserved and underrepresented people. I've also like wanted my work to kind of like highlight folks that are not typically seen, that are not typically heard, to kind of validate voices that you don't always hear around the table. And my work in How Women Invest kind of matches that and kind of allows me to kind of live that out. It's also like mirrored my own personal journey in a way. Like throughout my career, I really tried to like work hard to kind of create spaces where folks with different lived experiences and different perspectives contribute to the solution. And it could be bringing more people onto my team that have different lived experiences. It could be asking the question to make sure that those perspectives are heard. It's inviting, instead of waiting to be told, it's inviting people to kind of share feedback that might be helpful to the solution. And my experience has been that when you do that, the solutions are just better. It's just like, you just get better results, especially when you're tackling really hard problems, which I think healthcare is a really hard problem. Like you want all of the best thinking around the table to kind of lead to the best solution. And so my lived experience, like the impact is real when you do that. And so I've said this before, like I just believe that social circumstances shouldn't dictate like your opportunities. I believe that deeply in healthcare. I equally believe that in entrepreneurship. That's part of the reasons why I participate in the venture funds that you just, as limited partner, as you just laid out. And for me, like supporting How Women Invest just ensures that folks with great ideas, oftentimes with lived experience, super close to the problems that we're trying to solve, get the resources and support to be part of the solution. And so I believe that's how you drive meaningful change, and that's what I want to support.
We're at a moment in time, which is your language, I like that, when we've seen Congress reduce funding for Medicaid in particular, and it is just a moment in time, but it's an important one. Your company, Waymark, was created to bring the benefits of tech-enabled healthcare services to Medicaid beneficiaries, at least as one big piece of that. Yeah. How is this situation affecting your work? And I'm really interested in the kinds of steps you're taking to adapt to this, as we say, moment in time, but this change, which is clearly significant for your clients as well as your organization.
Yes, there's just been so much external attention and noise to Medicaid that it's been a hard time to do the work because you're navigating hard work with all this external noise, and it hasn't been positive noise. It's like we're pulling $1 trillion out of the system over the next 10 years. We're asking folks to validate and meet work requirements to maintain eligibility, all the things that are just kind of making it harder for people to kind of access healthcare. So that's just like the reality. I would say from my Waymark perspective, like our mission has not changed despite all of the external noise. I mean, the company itself was founded like 4 years ago as like a public benefit company, and we were founded to like improve access and quality of care to patients with Medicaid benefits. And so that is not changing. We're kind of continuing to do that work. That mission like guides everything we do. It guides how we show up for each other internally in the company. More importantly, it guides how we show up for our patients and partners, our healthcare system, and FQHC partners in the communities in which we're actually doing the work. So regardless of what's going on in Washington, like from just us as team members who care deeply about the work and are currently doing the work, like we want to keep an eye on that ball, regardless of what's happening in Washington. The same time though, like we don't put our heads in the sand, right? And you can't like ignore what's happening in Washington. And the complexity is definitely increasing from our patient perspective. You are still eligible for the benefit, but it's going to be a little bit harder for you to ensure that you maintain access to that benefit. But the reason we built the company the way we did, and we built it as like a tech-enabled, community-based model, is that it is important to just like continue to be in community with folks. You want to meet people where they are.
Right.
And so we're actually really well positioned to do that. We have community health workers and care navigators that we hire from the communities in which we are working, who know the resources and know where people go to kind of get connected with all of the resources needed to kind of maintain health, which is in addition to be connecting to primary care providers, you need to be connected with food banks and like housing resources, all of the other things that drive, all the health related social needs that drive poor health incomes as well. So on that in that sense, when like efficiency and outcomes kind of matter more than ever, because that's what we're hearing from Washington, and that is the reality of what our health plans and health systems are facing as well. Like when resources are constrained, it becomes more relevant to be in community and be able to show that you're driving outcomes that we are driving, which is keeping people out of the hospital when they don't need to be there, and improving their care goals and metrics as well. I think the last thing I will say is like what we're hearing from the market, and the market is both patients, it's like healthcare systems and clinics, it's health payers, is that it's just like validating the work that we're doing. Health plans and health providers are looking for solutions where you can meet people earlier in their healthcare journey and kind of prevent the avoidable inpatient utilization and kind of keep people healthier. Our model is that we've developed technology that will predict 9 out of 10 times whether a Medicaid patient is going to use the ER for what I call like a nonsense reason, right? Like you have unmanaged asthma because you live in poor housing. You have managed hypertension or high blood pressure. Like all of these chronic conditions can be managed, but when they're not managed, you end up doing it in the ER instead of living upstream of the problem. So we are able to identify those folks that are likely to use the ER for avoidable utilizations, and then we use our community-based teams to kind of wrap around them with primary care providers to get upstream of that problem. Health plans and systems are saying in this current environment, like we need solutions like that more than ever. And so they need proven outcomes, they need technology built specifically for the patients that they are serving, that's what we do. And then they need people that can help navigate them through an increasingly kind of complex administrative and healthcare system. And so we are adapting by recognizing that, but probably more importantly, just kind of continue to kind of keep our eye on the ball and kind of continue to do the work and showing up for people in a really wholehearted, heart-centered way. Because in addition to doing the work, like people are scared and it's an uncertain time, we want to make sure that we're recognizing and validating them as well.
I suspect that it's certainly made the word access, which is one of your featured foci, a much expanded definition of what are the limits to access and what you need to do in response to that. Is that the case?
That is the case. It is both a where are you looking for people to access, right? And our thesis is in the U.S. we've designed a healthcare system where ERs need to take all comers, but that's like usually like the worst place for us to be optimizing access, right? Like we should be optimizing access to like primary care providers and pharmacy care, so you can get the drugs and medications you need to be able to kind of better understand your chronic conditions. It should be understanding what motivates people to take action in terms of healthcare behaviors that they need to take action on, right, to kind of keep healthy. So yes, like access is like this catch-all, but I think we should be really specific in terms of like what we mean by access, and we want to make sure that we're providing access to the most like impactful, supportive environments from folks, as opposed to kind of like catching them really at the end of the line where it's both more expensive to the healthcare system because getting ER, like taking care of like basic conditions in the ER doesn't make any sense, and you're generating poor health outcomes for folks. It's like a lose-lose. We can definitely be better.
Yeah. Well, I appreciate that. I think that it's really important what you're saying, and the kind of move. I think very many people when they hear the word access come at it from an individual perspective, as though access were an individual's problem, as opposed to a systems problem, or even more importantly, kind of a whole problem of the social ecology. Because if people's asthma is affected by the fact that their housing is in the line of, industrial air pollution, all of these things come together. And I appreciate the kinds of integrative and comprehensive approaches that Waymark and you approach these. I think they're critical. That leads me, though, to a really important personal question, too. How the heck do you maintain focus when you have so many things demanding your attention? My goodness, woman.
That is that's really funny. Well, I'll answer it maybe like four. It's a very serious question, so I'm gonna answer it in that spirit. And four things come to mind, so I'll share those. So the first thing, because we're just doing hard work, like I never want to move so fast that I don't take the moment to kind of celebrate the wins. Work generally is hard. Healthcare work is really hard. Healthcare work for underserved and underrepresented folks is super, super hard, especially in the Medicaid space where you have like less margin to actually really do the work. But the pro of that is that you can move the needle so dramatically and so beautifully if you do the work. I think you need to find a way to maintain motivation. I do maintain motivation if I'm only focused on the next thing without acknowledging what we've accomplished. Like for me, I'll burn out, and the work won't be as fun. So, and I do that in small ways. Like we've built it in our company culture, right? So in every all company, we have a day in the life of care delivery where we have one of our amazing team members speak to the impact they've had with a patient or a family. And I think it's just so incredibly important because there's definitely moments where I'm like, oh, this work, like I feel the slog of the work. Like that's just honest. It's hard, it's slow. But remembering even just impacting one patient, one family, is transformative for that patient and the family. And I don't want to undervalue that. So the first is I don't move so fast. So I don't take the time. I do take the time to kind of celebrate the wins. The second is that I am very fortunate in this. I lovingly cultivate my tribe. The folks that like are around me that believe in the work, allow me to do the work, support me in doing the work. I've learned through my career that you cannot do it all. Like you're setting up yourself for success if that's your bar. Perfection cannot be your bar. And so I appreciate everyone. I appreciate my family. I appreciate my kids, my husband, my team, my work colleagues, like my personal network, all the people that allow me to truly support me personally and just kind of keep my spirit filled up, but allow me to delegate as well, to kind of allow me to kind of focus on the things where I think the Lord has blessed me to be uniquely qualified to do. And so the second thing is I don't think there's any way to maintain focus if you don't trust the people around you that allow you to do it. That's second. The third is that I rarely multitask. You'll think it's funny. Like if I'm in a meeting, I'm like looking you in the eye, Doug, and we're in this meeting. I'm like not slacking or sending an email on this side. And I do that for a couple of reasons. I mean, the research shows that your brain just ain't really good at it. And probably more importantly, I just hate how it makes me feel. Like I feel like I'm not doing anything well because I'm, divided attention all the time. And so I think I've gotten comfortable with that by realizing that if I've chosen to spend my time and do something, like that's the most important thing I should be doing. You do all the pre-work, right? To kind of prioritize and make sure you're working on the most important things. But once I made that decision, I should be fully in terms of like what I'm working on. And so that helps a lot for me, like just being present when I've chosen to spend my time to do something. And then probably like the fourth is more personal. Like I try to, for me, like everyone needs to find the time that allows them to ground themselves. For me, it's like periodically going for a run without headphones. For me, that shows up in terms of like it's my prayer and kind of like just meditation and gratitude time. So I do that, not as often as I like, but I try and get out 1 or 2 times a week and do that. Every day I do spend a few minutes in my Bible app, and I believe in the Lord, and like that has helped ground me as well, and so I do that without fail. It just kind of centers, those two things like center me, and it's just a constant reminder of gratitude as a practice that's really important to me, and I lovingly practice. And it also just is a reminder in terms of how I want to show up in the world, and show up to others, which above all is one of the most important things. So I don't know. I maybe I'll finish by saying, Doug, I don't think there's one one right way to do this. Everyone has to kind of figure out their thing. But for me, it comes down to like celebrating progress, trusting my people, being present in the moment, and being grounded in what I've identified matters most. Thanks for the question.
Lovely. Well, Afia Asamoah, it's been a delight having you here in the studio, and I'm looking forward to sharing this conversation with the rest of our community. Thank you so much for being with us.
Thank you, Doug. This is a lot of fun. I really appreciate you inviting me.
You have a great day. Bye now.
You too. Bye-bye.